Uh, Good morning, ladies and gentlemen. Please join me in welcoming the Honorable Minister of Health, Dr. Magdas Daba, distinguished guests, senior people-to-people leaders, and fellow advocates for women health. I hope this message finds you in good health and high spirits. While I regret that I cannot be with you in person to celebrate the 25th anniversary of this incredible organization and this pivotal conference on women health, I'm grateful for the technology that allows us to connect virtually. First, I want to congratulate the people-to-people family, leaders, and all its partners and volunteers for reaching this remarkable milestone. For 25 years, you have been a beacon of hope, support, and empowerment for women. Your unwavering commitment to advancing women's health and addressing critical issues has made a profound impact on countless lives. Today, as we gather to discuss and learn about women's health, let us remember the importance of our mission. Our world continues to change and the challenges we face may evolve, but the need for advocacy, education, and accessible healthcare remains constant. This conference serves as a platform to explore innovative solutions, share experience, and build a stronger network of support. I want to extend a heartfelt thank you to Honorable Dr. Magdas and the Ministry of Health for sponsoring this conference and serving as one of our strategic hosts alongside P2P and St. Paul Medical College. Your support and partnership are vital to the success of this event, and we are grateful for your commitment to advancing women's health. I encourage you all to engage with one another, exchange ideas, and collaborate on initiatives that will drive meaningful change. The work you do here will ripple out into communities, transforming lives and shaping a healthier future for women everywhere. Thank you to the organizers, speakers, and participants for your dedication and hard work. Your passion and commitment inspire us all. Though I cannot be with you physically, I'm with you in spirit, and I look forward to hearing about the outcomes of this conference. Finally, special thanks to the volunteers who are the backbone of our organization. Together, we can continue to find solutions for our challenges. And I leave you with a people-to-people motto: people's problem can be solved by people. Thank you.
Good morning or good evening to those who have joined us online. Probably we have a time difference in different zones, so we have to accommodate all. And but in here, we are in a very good mood with the rain. With the rain and cold outside, but I'm really happy to see smiling faces, happy faces, being home. And dear Minister of Education representatives, dear ATA representatives who are with us today, and university presidents who are among us in here, who are also probably joined us online, and Dr. Naugao, our P2P president, and the P2P board members and esteemed guests, whom the Ministry of Health really respects and gives due value. Good morning on behalf of the Ministry of Health and the Federal Ministry of Health and the people of Ethiopia. It is really my privilege and a great privilege to be amongst you. And for this great purpose, as Dr. Nauga earlier said, it's 25 years anniversary for the people to people. And I'm one of the lucky ones to be here on the Silver Jubilee. So why don't you clap for yourselves to say happy 25th anniversary? Having this type of great collaboration and a strong beacon to stand together that stands for more than 25 years is not a simple thing, and we don't take it for granted. It takes heart, it takes commitment, and it takes people, a person, to run like this. And I want to take this opportunity to thank everyone who've been through this 25 years. And this is the conference that just has been started before, but continues. And I want to take this opportunity to say that we will continue to be with you. And we acknowledge every effort that you've been doing through people to people, through the people to people, but also individually at each level. The Ethiopian diaspora really stands as a powerful reservoir for talent, expertise, and resource. And the potential we have is one is for innovation in healthcare, but in innovation to work together for improving the health sector that we aspire to see in our country. If we ask each of you, I'm sure you will all say that I have a dream. I have a dream to see my country to be at this level. I have a dream to see a health professional who is capable of doing what I have seen being done in this corner of the country. And having you all in here means that you are still committed to do it. And we're also available to do it with you. And I want to take this opportunity to say to all of you that we're here and we will be with you to see the dreams come true. Strengthening our collaboration through the recent memorandum of understanding that we have done with the Ministry of Education, Education and Training Authority, with people to people, is one of the strategic alliance that I see as a great opportunity to strengthen our professional training, to see that we have an accredited medical school. Recently, last week, we had launched our accreditation roadmap, which is a very good opportunity for us, because one of the things that we wanted to know is we have a healthcare institution and trained professionals who are also accredited to function not only for their country, but also out of their country. So we are at that history-making process, and a time that we have a new policy, the new health policy, which has been on use the past 13 years, which has just changed. We just recently changed it last week, was the new health policy. The fourth health policy has been adopted by the cabinets. So I would say that we are at that history juncture that we are making a great progress, and that memorandum of understanding would be used as an opportunity to have accredited health professionals who are trained, and for having our health professionals use their capacities in here and beyond. Through this partnership, we aim to fortify the foundations of our healthcare system, ensuring that our health professionals are equipped with the skill, knowledge, and attitude, but also accreditation is necessary to make that we have the needs of the population at large. Our population need a quality healthcare and a certified health professionals, not just for the country, but also beyond for the region in Africa, and beyond for the whole continent. If we see the course of our future collaboration, we see that there are still great areas that we can collaborate further. One is around increasing our skill transfer, which we started before, which has been there as a work of people to people. But we would strengthen, and I'll call upon your commitment to strengthen that collaboration of skill transfer. The other one is we have also other platforms. We are lucky that since COVID, even now Dr. Naugao has joined us online. We don't have to be in person as before. We can use digital platforms, and digital health strategy has also been implemented now. In the past few months, we are trying to take several strategic outlines and strategic guidelines being out, one of it being our digital strategy, and the other one is our health workforce strategy, which will be released very soon, next Thursday. Our team has been working tirelessly to have that. So we want to work with you in enhancing the skill of our healthcare professionals with your commitment to do skill transfer and fostering our continued professional development with CPDs, because our internal licensing has been now changed from every 5 years to every 3 years. One of the key things that we put for licensing is for accreditation and licensing is our CPD, the continuous professional development that our health professionals in every sector, be nursing, laboratory, physicians, residents, specialists and subspecialists, would have to renew their license now every 3 years. And recently, the government is also working in having the civil service reform. That would be part of the things that we would give due attention, which is having continuous professional development and to have a health professional which is both equipped but competent, but also compassionate. That would be the thing that we would continue to work with you, and I'm sure we'll get your support through that. And the other one is I'll call upon you to continue to support us as usual in expanding our healthcare services and pharmaceutical production. We have now one key strategy to make sure that Ethiopia produces, Ethiopia consumes, and share to the region and beyond. Because what we've learned after COVID is when the doors are closed, we were you know that Africa has been left outside before the other world finished having almost 90% of the population in the other world was vaccinated or got the vaccine before the first dose arrived to Africa. I would say the entire Africa. And that lesson has already brought us to the commitment we have now to have production in here. It doesn't have to be only vaccines, but production in here. You remember with self-protection equipment not being around, and we've been struggling. And even for the smallest innovations we wanted to do with hand hygiene, sanitation, people came with amazing ideas. So we believe that we have the potential in here, but if you collaborate, if we strengthen our local manufacturing and production, the doors are open for you now. Government is committed, place has already been dedicated, and system has already been in place. But there is no perfect system in the world. We want to work with you. We want to make this work so that we produce, Ethiopia produces, consumes, and also shares to the globe. And this is an area that I would want to call upon you, because in addition to the previous collaborations we have on training, on building health institutions and infrastructures, this is another additional area that we can collaborate further. Doors are open, and we want to work with people to people and all diasporas outside, especially health professionals, with the passion. I know every time you walk on the wards and you see a patient coding, I remember one of my friends calling me one day and said, Magdas, when you have a coding, how do people communicate in our ward? I completely forget my hospital when we do our general practice. And I told them, we still have to do a lot. It's not the same. I know the pain that you feel when you are walking in the wards or in the different institutions, but we have an opportunity. The doors are open. We can do together. We can improve not only the healthcare system, but Ethiopia in general if we work together. And I believe this is a time that we would see our dreams come true. Things might not be as we expect, and it might be still cloudy outside, but the sun would still rise. And I have that hope that our country would be at that level, that the sun will rise and we will shine as a country and also as a continent. My heart for the country also goes beyond our country, Ethiopia, because everyone in Africa is also looking at us. We are sharing health professionals now. We have doctors who are at different corners of Africa. And this is an opportunity for us to share our skills. We use it as an opportunity to say that Africa stands to share its resources, and Ethiopia, at the center of it, it will continue to share competent and committed health professionals that would go beyond borders. Thank you very much for everything that you've been doing. And as we embark this journey to open this session, let us still remain steadfast in our resolves and in our commitment to build a healthier and prosperous Ethiopia. I believe that we together have a power to shape the future we want to see for ourselves, for our children, and for the generation to come, and to ensure that every individual has access to quality healthcare. Urban, rural, women, male, everyone, children, older people, throughout age and throughout borders, and no barrier for everyone to access healthcare. So I call upon everyone, as this theme for this year is about also women, as an OBGYN, as a reproductive health subspecialist, my heart and compassion still relies with women. We know that there has been a lot that has been done in the past few years, but we still remain behind. We have an ambition to reach several targets by 2030, including eradication of things that we might not think we can eradicate, including TB, several other communicable and non-communicable diseases. Women still need to have an access for screening. Women needs to have an access for curative services, but mainly for prevention. So I take this opportunity to call upon everyone to commit further to reach into women and girls, but also those who didn't have an opportunity so far. So let's have equity at the center of our discussion. Let's have our commitment to say that women would still benefit from increasing advance in science, advance in technology, and advance that they deserve to benefit from scientific advances. This discussion that we will have today and tomorrow would be an opportunity for us to commit for having access for scientific advances. And I use it as an opportunity for skill transfer, knowledge transfer, but having an ambition to say that we can do it together. Thank you very much.
Thank you, Your Excellency. Really, what an inspiring message. And we will take it at heart, your message, and behalf of people to people, and also some of my friends who are in the diaspora, we will follow through and we will try to keep in touch as much as possible.